for this.
Okay, Sherry, I think we can get started.
Oh, okay. Um, all right then. So again, thank you to those who have come to this presentation. Just to give a little introduction to myself, my name is Shari Law. I am a current Master of Public Health candidate from Rock University with a strong foundation in biomedical sciences from the University of Waterloo, where I did my undergrad. I have experience in healthcare research and community-based initiatives. I've also worked on projects with Holland Bloorview Kids Rehabilitation Hospital, including knowledge translation to children. I bring expertise on data collection and analysis, epidemiology, and health promotion strategies. I'm also passionate about improving population health, and I am here to share my insight on the importance of preventing the spread of airborne infectious diseases. Okay, um, so I'm happy to be here on this Tuesday morning as a part of the Be Happy, Be Healthy education series. And again, let's turn our attention to this, right? The importance of preventing the spread of airborne infectious diseases. So before we begin, let's start with some quick questions. Um, these quick questions. Now, when you answer, if you would like to answer, you can text in the chat or you can unmute to talk. Just a reminder that this presentation is being recorded. Keep that in mind. So, first question, which of these diseases are spread through the air? A, COVID-19, B, influenza virus, C, HIV, and D, tuberculosis.
I think it's COVID.
Yes, that's a great answer. Um, it's multiple choice. You can choose all that apply.
I'll
So we
say
have
maybe A and B and then D question mark.
very great answers.
I know this.
This is the reveal. COVID-19, influenza, otherwise known as the flu, and tuberculosis are all diseases that spread through the air. However, HIV is spread through contact of bodily fluids. Our next question is, how many people do you know have had a contagious disease like COVID-19? And what precautions do you take to keep healthy from airborne infectious diseases?
I think I think just about everyone I know has had a contagious disease, whether it be COVID-19 or the flu. Um, I feel like when things are ramping up and it's getting really bad, I'll wear a mask, but for the most part, and like I always wash my hands. Like I know that that's not airborne, but I also know washing your hands can be important. So yeah, and vaccines.
Vaccines. Thank you, Ria, for sharing. Fun fact, I don't think I've ever had COVID. Um, it was kind of crazy, like the wave had hit so many times, and surprisingly, I've never caught COVID. It's kind of crazy. But thank you for sharing, everyone. Yes, vaccination is very important when it comes to protecting yourself. These are our learning outcomes of the day. One, understand how airborne diseases like COVID-19, the flu, and norovirus spread. Two, identify effective strategies to limit spread, control, and prevent infection. Three, recognize the importance of public health measures in managing outbreaks. Okay. Now, let's get into the definition of airborne infectious diseases. These are tiny bacteria or viruses that travel in small droplets. These droplets are released into the air when someone sneezes, coughs, or laughs. Some examples, as we know, COVID, the flu, HIV, chickenpox, and measles. Now, why should we care about airborne infectious diseases? First, airborne diseases have widespread impact. They spread very quickly in communities, affecting large numbers of people in a short time. Airborne diseases increase the risk of an outbreak due to how easily they are spread. Thirdly, airborne diseases are demanding on staff and healthcare resources in clinics and hospitals. Lastly, airborne diseases affect vulnerable populations such as children, seniors, and individuals with weak immune systems. In this presentation, we will be going over transmission, prevention, and public health measures of airborne infectious diseases. How do airborne pathogens spread? As you might have heard earlier, we talked about droplets. Droplets are large particles that are released when a person coughs, sneezes, talks, or laughs, which travels and settles on surfaces or in the air. Aerosols or dust are tiny particles that float in the air for a longer period of time, which can travel and spread farther in poorly ventilated areas. So we are going to watch a quick video about how far aerosols can travel. It's called How Contagious is a Single Disease?
We're not hearing any sound, Sherry. Are we supposed to?
Oops. Okay, thank you for letting me know. But luckily I turned on the captions, so if you heard the or if you read the captions, that was good. Let me I'm not sure how to share sound. Oh,
Sorry, before you share the video, you have to have clicked the enable audio as part of your instructions around the sharing.
oh,
Don't know if you did that when you embedded it in your slides.
oh, I see. Okay. Please let me know if you can hear this.
Are you sick? Don't you dare sneeze on me.
Okay.
Do you know how far your germs can travel?
Thank you, Sam.
Normally you hold about half a liter of fluid in your lungs. So when you sneeze, you're able to spray as much as a water bottle's worth of mucus into the air around you. It shoots out of your mouth in the form of moist, germ-infested clouds, traveling up to 35 meters per second. That's fast enough to give you a speeding ticket on the highway. Once that cloud hits the air, it expands, breaking up into snotty strings, then a series of different-sized droplets, all trapped in a turbulent gas cloud. One brave group at MIT discovered that the biggest droplets can travel up to 2 meters, about the distance between your desk and 2 desks away. But most other droplets? Those travel much farther, up to 8 meters. That's about 5 desks away. Not only that, the germ-infested gas cloud is less dense than the air around it, so it rises upwards, right to where ventilation systems and other people's unsuspecting noses and mouths await. Even though these are relatively smaller droplets, they're probably still teeming with harmful pathogens, like the flu virus. Even worse, depending on the ventilation, they can spread through a room in just a few seconds, and remain suspended for up to 10 minutes. Now, if you happen to notice someone around you sneeze or cough, you can hold your breath as you move out of range. But during the flu season, that might not even be enough, because there are danger zones everywhere, especially on surfaces like desks, doorknobs, and steel handrails. It turns out the flu virus has been found to survive for 24 hours on a steel surface. And if you touch that surface and don't wash your hands before eating, you may have just gotten infected. So let's say you go into work sick with the flu one day, and you start to sneeze. Now, according to one study, you'll probably only infect 1 to 2 other people. You're clearly showing symptoms of the flu. However, it's going to take a few days for symptoms to show up in other people you've infected. So those poor souls unknowingly also come into work sick over the next few days. And they will potentially infect 1 to 2 more people. In an office of 100 desks, this could mean 10 or 15 sick people by the end of 2 weeks. That's over 10% of the office. And all of it started with just one sick person. You. All thanks to the germ-laden cloud you so generously shared. So the next time you're not feeling great and you're sneezing up a storm, just think about your poor coworkers and take a sick day for yourself and for them.
Video. We are going to ask a bit of questions and have a little discussion. Are there any thoughts? Did you learn anything from the video? Do you have any concerns about the video? No? It was quite straightforward. Did we learn anything new? Okay, we can move on. All right. How do you prevent airborne infectious diseases? There are lots of ways. First, we obviously have masking, which you likely did during the pandemic. This stops any droplets from entering or leaving your nose and mouth. We have proper hand hygiene, as Sharon mentioned earlier, with soap and water or alcohol-based hand sanitizer to clean your hands if you come into contact with any diseases. Public health authorities recommend an alcohol-based hand sanitizer that is 60% or higher to effectively kill germs. So when you are shopping for hand sanitizers or sanitizing wipes, please keep a lookout for that. Then we have some advice, such as avoiding crowded areas during an outbreak and ensure good ventilation in indoor spaces. Stay up to date with your vaccinations against airborne diseases. Cover your coughs and sneezes with a tissue or with your sleeve near your elbow. And please follow your local public health guidelines during an outbreak. Some of those guidelines might include isolating or social distancing. So here are some general health and wellness advice. Eat lots of fruits, vegetables, water, and have a balanced diet. Exercise, get lots of fresh air, and limit harmful substances such as alcohol and smoking. And now you have to protect your mind. Ensure quality sleep and consider meditation or positive coping mechanisms to manage stress and anxiety. Does anyone have any suggestions that they'd like to use for general health or wellness? Oh. Well, we talked about quality sleep and meditation. I think some people also recommend picking up a hobby or visiting the gym regularly. All right, we can move on. Now, what do the public health guidelines? Oh, I take vitamin D. Yes, that is very important to take vitamins. Okay. Now, what do the public health guidelines do during an outbreak of airborne infectious diseases? Social distancing reduces close contact between people to limit disease spread. This is very important in crowded or poorly ventilated areas. Contact tracing helps identify and notify others exposed to an infected individual. This helps break the chain of transmission by encouraging others to get tested and to socially isolate. Actually, contact tracing was a whole career during COVID-19. Quarantining means to stay away from potential exposure to prevent spreading the disease. And social isolation encourages separation from others when infected. And please stay informed on guidelines from trusted sources. Does anyone have ideas on what a trusted source is? So a trusted source is a peer-reviewed, public official reviewed information that's spread to the public. Okay. So now that we have learned more about airborne infectious diseases, we can have a little discussion. Oh, would news sources be reliable? I think that's a very good question. When it comes to news sources, sometimes this comes from a whole team of researchers. But I know smaller news stations have maybe a smaller team and they might spend less time on fact checking their sources. So I think when it comes to news sources, maybe metropolitan news sources might be a little bit better. Thank you for that question. Okay. How have airborne disease prevention measures impacted your daily life? You can text in the chat or you can unmute and discuss if you would like. But I will still give everyone a minute to think the question over. I can also start. Oh, okay. Sometimes news article link the study they're referencing, so it might be good to double check sources or info to be better informed as well. Thank you so much. I think that is true. I will also give it a heart. Yeah, I think it's very important to triangulate when it comes to researching. I remember it being a big obstacle in social interactions, especially in university. I think that is true as well. When it came to the pandemic, it obviously introduced so many different guidelines that impacted social interaction. I think nowadays a lot of PPE is more available now. It's much easier to get a mask when it comes to visiting clinics or hospitals. Okay. We can move on. Now, what challenges have you faced when following public health guidelines? I think that was already mentioned. Social interaction took a big hit. For immunocompromised people, perhaps it was harder to stay safe. Does anyone have any other challenges they might have faced?
maybe in terms of work, like if you are in a position where it's really hard for you to take a day off, it might be hard to like um, do that, like take that time for yourself and stay at home. That might be a limitation for people.
Oh, yes. Thank you, Ria. Yeah, I think we didn't even mention how employment took a hit as well, your work life, especially if you were an essential worker, perhaps um, being at the front lines, it was difficult to take time for yourself, and it was an issue for mental health as well. So thank you for mentioning that. Okay, next questions. What additional support do you think the community needs to stay safe? What prevention strategies have you used to protect yourself and others? Have you heard any that you might use today? Definitely vaccinations. Um, yes. I think a bigger vaccination campaign might help. I feel like these days I know less and less people getting their flu vaccine every year. I think that could be something that's improved on in the community. Um, Vaccination is important when it comes to preventing diseases and protecting yourself and others. Mm, I think that's quite a good idea. Okay, we can move on. Um, we're actually nearing the end, but here is a short list of research trusted sources from the government and public health organizations. I know we talked a bit about trusted sources earlier when talking about news sources, but I think when it comes to public health guidelines, we should really be reaching for global health organizations. Um, this is an organization that's full of researchers and public health officials that work towards keeping our community safe. So some trusted sources include the CDC, which is the Center of Disease Control. We should be trusting the Ministry of Health, public health units. I've included Toronto, but I know not everyone lives in Toronto. Everyone has a local public health unit. The Canadian Public Health Association. So this is a pretty comprehensive list of trusted sources. We also have our resource list over here, which talks about more about airborne infectious diseases. It mentions everything we've heard today and a bit more. I will be posting this list in the chat if you would like to see. There is a handout that has a very comprehensive list of prevention strategies. If you have a minute, also please complete this survey. It just helps me gauge whether or not the information was helpful today or if you learned anything. Here is this list.
You want to put the link to the survey in the chat?
Yes,
Sorry.
I just posted it. Okay. I've also included the link to today's video if you would like to watch it again, because that was some very helpful animation. I had no idea that a sneeze could be as fast as someone driving on the highway. That was pretty interesting to me. Okay. Otherwise, thank you so much for listening and attending this weekly session of Be Happy, Be Healthy. I will stay back if you have any questions, or if you'd like to discuss more on this topic. Thank you.
Thanks, Sherry.
Thank you, Deborah. Okay, I will also be stopping the recording.